Good morning. It's July 1st, and this is your daily brief in science. Here's everything you need to know. Microsoft AI has made a significant breakthrough with its diagnostic orchestrator known as MAI-DxO, which diagnoses 85% of complex medical cases sourced from the New England Journal of Medicine. This performance starkly contrasts with practicing physicians, who average only 20% accuracy in similar cases. The technology is designed to complement human doctors, allowing them to concentrate on building trust and enhancing patient care rather than replacing them. Currently, MAI-DxO is still in the research phase and requires extensive validation before it can be applied in clinical settings. Partnerships are being formed to conduct real-world studies to assess its effectiveness. However, concerns have emerged regarding the validity of the AI's exam performance, emphasizing the necessity for further testing prior to clinical use. Experts have pointed out that the real challenge for MAI-DxO will be its integration into busy hospital workflows, despite its capability to manage the complexities of clinical reasoning. The potential of this AI technology could lead to cost-effective solutions, particularly benefiting healthcare systems in developing regions. Despite these advancements, a report indicates that 60% of Americans feel uncomfortable with healthcare providers relying on AI, fearing it may compromise the patient-provider relationship. The next steps for MAI-DxO involve validating its effectiveness through clinical trials and comparing its results with those of actual doctors treating patients. Wes Streeting, the health secretary, is advocating for the integration of AI within the NHS to enhance healthcare efficiency, particularly as NHS waiting lists have recently surged. Future efforts will also focus on real-world testing and collaboration with health organizations to ensure safety and effective integration into clinical practice. The AI system aims to expedite medical treatment and reduce costs by minimizing unnecessary testing, showcasing substantial cost savings potential. The concept of medical superintelligence reflects the transformative impact of this AI technology, emphasizing deep clinical reasoning over mere memorization. A groundbreaking study from the Buck Institute for Research on Aging has revealed that brain sugar metabolism could be key in protecting against Alzheimer's disease and other forms of dementia. Researchers focused on the breakdown of glycogen in neurons, discovering its potential role in combating neurodegeneration. In models of tauopathy, tau proteins bind to glycogen, which traps it and prevents its breakdown. This impairment hinders the neuron's ability to manage oxidative stress, a critical factor in neurodegeneration. The study identified that enhancing the activity of an enzyme called glycogen phosphorylase, or GLIP, can help clear excess sugar from neurons, leading to reduced tau accumulation and oxidative damage. Interestingly, GLIP levels can be increased naturally through fasting, and its activity may also be boosted by GLP-1 receptor agonist drugs, commonly prescribed for weight loss. Additionally, dietary restriction has been shown to enhance GLIP activity, resulting in improved outcomes in tauopathy models. Researchers noted that pharmacological mimetics like 8-BR-CAMP can replicate these beneficial effects. The collaborative research approach, combining expertise from diverse fields such as fly aging, neurodegeneration, and human-induced pluripotent stem cells, significantly contributed to the findings. The implication suggests that GLP-1 drugs may not only aid in weight loss, but could also serve therapeutic purposes against dementia by mimicking dietary restriction and promoting healthy brain metabolism. Moreover, similar glycogen accumulation and protective effects of GLIP were observed in human neurons derived from patients with frontotemporal dementia. Professor Pankaj Kapahi highlighted that glycogen actively participates in neurodegeneration, rather than merely acting as an energy reserve. The study's conclusions were strengthened by the collaborative efforts of laboratories at the Buck Institute and Emory University. Astronomers have made a groundbreaking discovery of ancient radio signals from the distant galaxy cluster Sparks 1049, which could provide crucial insights into the formation of the early universe. Utilizing the low-frequency array, or LOFAR, a sophisticated radio telescope comprising 100,000 antennas across 8 European countries, the research team detected a faint radio signal originating from Sparks 1049. These radio waves, which traveled an astonishing 10 billion years to reach Earth, represent the first detection of such signals at this immense distance. The mini halo from which these signals emanate spans over 1 million light-years, a structure previously only observed in nearby galaxies, underscoring its significance in astrophysical research. Mini-halos consist of faint groups of charged particles that emit both radio and X-ray waves, typically found in clusters between galaxies. The researchers proposed two primary explanations for the formation of this mini-halo: either the activity of supermassive black holes ejecting high-energy particles, or cosmic particle collisions occurring within the cluster's hot plasma. These findings suggest that the influence of black holes or particle collisions may have energized galaxies earlier than previously believed, thereby expanding our understanding of cosmic evolution. Co-lead author Julie Hlavacek-Larondo expressed optimism that this discovery opens new avenues for studying the energetic conditions of the early universe and the processes driving the growth and evolution of galaxy clusters. Roland Timmerman, another co-author of the study, emphasized the significance of the strong radio signal, suggesting that energetic particles have been shaping galaxy clusters for nearly the entire history of the universe. Future telescopes, such as the Square Kilometre Array, will play a crucial role in further investigating these phenomena, including the influence of magnetic fields and cosmic rays on the evolution of the universe. This research, accepted for publication in the Astrophysical Journal Letters, was co-led by Hlavacek-Larondo from Université de Montréal and Timmerman from Durham University's Institute for Computational Cosmology. Overall, this discovery provides valuable insights into the nature of galaxy clusters shortly after their formation. A new chapter in genetic research is unfolding with the launch of the Synthetic Human Genome Project in the United Kingdom. This ambitious initiative aims to create the first synthetic human chromosome within the next 5 years, potentially revolutionizing our understanding of human biology. The project is led by Jason Chin from the University of Oxford, who will work alongside various universities and research centers across the UK. The goal is to develop innovative methods for synthesizing human genomes from scratch, which could significantly enhance our understanding of health and disease. Funded by the Wellcome Trust with an initial investment of approximately $13.7 million, this project seeks to improve our grasp of human genetics and assist in curing diseases. The Wellcome Trust has committed around $11.7 million, believing that the potential benefits of this endeavor outweigh the associated risks. While the project promises groundbreaking advancements in biotechnology and medicine, it also raises significant ethical discussions regarding the nature of life. The complexity of the human genome presents challenges, including concerns related to designer babies and eugenics. To address these ethical issues, the project will incorporate a social research component aimed at exploring the implications of synthesizing human genomes. Despite some scientists expressing concerns about the misuse of synthetic human DNA, the project is dedicated to addressing these issues responsibly. Chin highlights that the ability to synthesize large genomes could transform biotechnology and medicine, enhancing our understanding of genome biology. This initiative builds on previous successes in synthetic biology, including the creation of a synthetic bacterium genome in 2010 and the synthesis of viral and yeast cells. Researchers also aim to uncover the functions of dark matter within the human genome, an area that remains poorly understood through genome synthesis. The outcomes of this project could have profound implications for the future of genetics and medicine. A recent study from Tulane University has raised significant concerns regarding New Orleans' flood protection system, which is valued at $15 billion. The research reveals that this system is sinking at an alarming rate of up to 28 millimeters per year, nearly 10 times the rate of sea level rise. Utilizing satellite-based interferometric synthetic aperture radar, researchers mapped vertical land motion, indicating that many floodwalls and levees built post-Hurricane Katrina are sinking faster than the rising sea levels, thereby diminishing their protective capabilities. Co-author Professor Mead Allison highlighted the urgent need for continuous monitoring and maintenance of these flood defenses to ensure they remain effective against storms. New Orleans depends on a complex network of levees, pumps, and drainage canals, making it crucial to address the risks associated with rising sea levels and sinking ground. The study identifies ongoing geological challenges, including natural sediment compaction and human activities like groundwater pumping and wetland drainage, as contributing factors to this subsidence. Specific regions, particularly around industrial sites, the airport, and newer residential developments, are noted for their significant sinking. The area surrounding Louis Armstrong International Airport exhibits the most severe subsidence, with a rate of 27 millimeters annually, largely linked to recent construction activities. Furthermore, newly built concrete floodwalls are sinking at rates more than 7 times greater than the current sea level rise of approximately 3.6 millimeters per year. Lead author Simone Fiaschi emphasized that even slight drops in elevation can greatly increase flood risk in a city like New Orleans, which is already at a precarious elevation. The findings of this study, published on June 27, 2025 in Science Advances, stress the importance of understanding land movement patterns for effective urban planning and infrastructure maintenance. The researchers advocate for enhanced satellite monitoring and additional investments to maintain the flood protection capabilities of New Orleans. This has been your Daily Brief in Science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.